can we increase the consumption of healthier foods and beverages in Hastings and Prince Edward counties? Most parents know that healthier food and beverages are important for their families. In a recent Healthy Kids Community Challenge survey of 262 parents of children ages 0 to 12 throughout Hastings and Prince Edward counties, 100% of parents surveyed felt that it is important or very important for their children to consume vegetables and fruits every day, and 90% of parents felt that it is important or very important for their children to sip water throughout the day. Yet parents are limited by many factors when it comes to making healthier choices for their families, such as time, cost, distance to the nearest supermarket or food provider, and children's dietary restrictions and preferences. So how can we make it easier for children in Hastings and Prince Edward counties to eat healthier foods and beverages? It will take a community effort, whether at home, school, a recreation center, or community space. Children come into contact with different settings, programs, and individuals throughout their day, all of whom can help them to develop healthier habits. As a part of a recent review of food and beverage programs, policies, and practices throughout Hastings and Prince Edward counties, we reviewed many possible opportunities to increase consumption of healthier foods and beverages and made recommendations by sector. Most children spend a large number of hours in child care or at school. Nutrition education and promotion in these settings can be very beneficial. School or daycare gardens are recommended where time and resources allow. 45% of parents reported a desire for gardens to be developed in their child's school or daycare. These amenities can offer an opportunity for children to take part in planting, growing, harvesting, and eating the food they grow. Community organizations like churches and libraries can also support nutritional education. They can do this, for example, by having a community garden on site or by offering a healthy eating book bin for children to access. Some sites may also be able to offer spaces like community kitchens, where families can come in to cook and eat with one another. Many children also take part in recreational activities or sports programs or visit local parks. Among parents surveyed whose children participate in programs or sport leagues at recreational centers, 89% believe that healthier food options should be available, and 85% believe that healthier beverage options should be available at these locations. 63% also believe that policies or practices should be in place that restrict the sale of sugary drinks such as soft drinks, fruit drinks, sports and energy drinks, and sweetened milks. Local restaurants and businesses have a role to play too. Currently, over 52% of parents surveyed reported difficulties in accessing fresh, clean drinking water outside of their homes. Local businesses can provide access to free drinking water or healthier snack alternatives. For example, grocery stores are encouraged to offer vegetables and fruits as snacks for children to eat while they're in the store. Local public health offices and not-for-profit organizations can offer food skills and cooking classes, facilitate partnerships with local food providers, deliver meal distribution programs, and offer other support services. The Healthy Kids Community Challenge is a community-based program that encourages parents, community members, and partners from many different sectors to work together to promote the health and well-being of children ages 0 to 12 years old. Together, we can have a positive impact on the health and well-being of children living in Hastings and Prince Edward counties.